think it was about 50 months ago, we gathered with colleagues, counterparts from New York, across research, public health, city administration in London. We were the first get-together where we were comparing notes about this, what is now an epidemic, a better theme of obesity, and particularly childhood obesity, comparing notes across the two cities. I think that itself is a breakthrough. One doesn't normally get the opportunity to work in a more same way with a sister city that's really facing similar, different problems and tackling similar, different ways. We then trooped across to New York, I think in April. We had a sort of shadow or a mirror meeting there over 2 or 3 days, and that again gave the Londoners an insight into how New York was tackling this particular issue. The report, so therefore, a 15-month gestation period, I think in policy and research terms, that's a pretty quick turnaround. So I think credit to Eileen, Kim, and the support team on both sides, putting this together very quickly. We have an action-packed morning. I think it's interesting we brought together food, sport, physical activity, public health, transport, and yet more food. Percentages, I think that in itself says that we need an integrated approach to this particular issue. So without further ado, I'd like to move on to the editors, the presenters of the Tackling Obesities report, Professor Eileen O'Keefe from London Metropolitan University, and Kimberly Libman from Sydney University, New York.
We're going to give you a race through the document that you have in front of you on the obesity epidemic in New York and what New York and London have been working on together. And it's going to be a double act. I have to apologize at the very beginning. It's going to be given totally in American, and we will agree to translate for anybody at the lunch break. But we have to take a decision about which language to use. This is American. Apologies for that. The question is why, number one, what were our goals? Number two, the issue of what we actually did, what the issue was about evidence, what our recommendations were, and what we can now do about it. What we got together in the first instance was to simply say, we are 2 big world cities. Who's actually given us a picture of what those 2 world cities are in terms of the nature of the populations, the nature of the structures that are in place in those cities, and the kinds of powers that they have in order to be able to address the issues that they face. So we thought in the first instance we would try to give you a preliminary snapshot of the cities. Then what we wanted to see is to say what could we actually learn from one another about the obesity issue, and to be able to say what can we do very specifically at the municipal level, because we know that there is a lot of activity taking place at the national level, particularly in this country, in terms of policy formation and so on. But what can you actually do if you're right here in the city and you're in a particular committee, you're in a particular role, what can you do in your role in that city to make a difference to obesity? We wanted to be able to then come up with some kind of a framework to say, these are things we really think can be done. And we're hoping that they are actually evidence-based. So what we've done is to take 2 major metropolitan universities. We worked together, as Graeme says, for about 1.5 years, 2 years. But we went around talking to people who should know about what's going on in the cities. So in New York, for instance, we talked to the New York City Office for mental health and hygiene. I don't think we would use that kind of language, health and mental hygiene. I don't think we use that kind of language here in England. But that organization did a lot of work with us, discussing what their policies are, showing us how they worked and so on, and the same with the school health people and the school food people. In London, as you can see, we spoke to really, really crucial people. The International Obesity Task Force, for instance, London Health Observatory. We had a tremendous amount of contribution from really key people who were looking at evidence and people who were making recommendations. organizations, people who are monitoring inequalities. We have to be concerned about childhood obesity. It isn't just about what we look like, it is really about the fact that obesity is now implicated very profoundly in the enormous inequalities, the health inequalities that exist, and that it expresses itself in so many of the long-term conditions that are now bedeviling us. Have a look at that. Some people think it's in our genes, but if stuff is in your genes, if you know your propensity to have difficulties of any health disorder in your genes, then you don't expect enormous changes in whole populations over very short periods of time. If you look at obesity in the United States, you can see over a very short period of time, just over a decade, you know, blue is 15 to 19%. But red is 30%. So if you get a big shift like that over a very short period of time, then there's something happening that, number one, is dangerous. We need to understand, but also that we need to do something about. That is, you know, such a rapidly developing, dangerous phenomenon. If one looks at one city, this is my favorite slide, in New York City, 2002 to 2004, the city gained 1 million pounds. So again, very short periods of time, big changes, and we're beginning to get some of the information that we need, only some of the information about what that's like at the city level.